Welcome to Scoliosis Channel, Episode 8, in our series of scoliosis management. And on this episode, we'll be discussing the management protocol. And what I mean by management protocol is the roadmap that the physician or the clinician, scoliosis clinician, will discuss and tell the patient and his family or her family the details about what's going on, what's diagnosis, what's our time frame, what we're gonna do in this particular case, what's risk, what's the advantage and disadvantage of different modalities. And this include all physicians, either MDs or DCs, surgeons, physiotherapists, orthotists, psychiatrists, and some radiologists if incidentally found that certain patient by accident has an scoliosis. Once the patient reaches a scoliosis clinician, the specialized doctor, it is very important to have a protocol and to be discussed on a team level and family and patient level, and family and patient orientation about this particular protocol, because there's so many factors influence the management and the procedure on this particular disorders. Of course, after we obtain the history and details and the clinical assessment, and we do our investigation, reach diagnosis. After we reach diagnosis, because scoliosis is a multifactorial, very complicated disorders that needs to be a proper diagnosis need to be reached. And in a way is, from my experience, patients will go to physical therapists, for example. They will order them, oh, we're gonna do exercise and we're gonna do bracing, which is good. Bracing exercise is a major modalities in treatment. But guess what? There was no diagnosis. This particular scoliosis, is it an idiopathic scoliosis? Is it congenital scoliosis? Is it syndromic scoliosis? Does this scoliosis has some red flags that a bracing, for example, could be catastrophic? The same way with surgeon. I found lots of surgeons, they are wonderful in surgery, but we need to reach a proper diagnosis. We need to know why this scoliosis, what type is it, how are we going to manage this particular scoliosis. The management plan should involve the proper diagnosis, and this should be exposed and told to the patient. Not all the scoliosis are the same. Even with the same patient in different levels and different phases, scoliosis change. Sometimes it goes like a cat, sometimes it goes like a tiger, sometimes it progresses so progressively and very fast. Sometimes the patient collapses within a couple of weeks and couple months. I mean, totally collapsed. We're talking wheelchair if it's not the proper diagnosis. And I've seen a lot of quote-unquote goodwill mistakes from PTs, from surgeon, from orthotists, just because they didn't reach the proper diagnosis. And they think, as they said, if you have a hammer, you think everything is a nail. He's a scoliotic patient, let's give him the brace, full-time brace, exercise, and so on. So this is a very important, it's a short presentation, but it's just put to get the patient oriented what's going on the health care for a scoliosis patient. So after a proper diagnosis, we put the management plan together, and we put the roadmap for the patient and the family and we put our target. Our target is to stabilize this curvature. Our target is to correct this curvature if it's correctable. Our target is to postpone the progression so we can reach the surgical intervention properly and efficiently. And after we set up the target, we put the time frame for our plan. We tell the cost in details for the family, the pros and cons for each modalities that we're offering, even the visit reputation, and all the valid options versus risks that we could take either to prevent bad progression of bad curves or stabilize or correct. So everything should be on the table on the management plan, and it should be shared with the family and the patient. Management protocol has we have observation, as we said, exercise, bracing, casting, surgery. All these are very critical and important modalities to deal with patients, or even with a single patient in different phases. So again, I have to repeat this. I cannot emphasize this enough. We need to approach to reach the right diagnosis, the 100% right diagnosis, in order for us to put the management protocol for this particular patient. Either we're going to observe for 2-3 months, or we're going to give him some sports treatment, a specific exercise, and we're going to have this in different presentation that represent all different schools around the world about, SHRAS, CS, all this nice and efficient protocols for the specific exercise for scoliosis management. Bracing also, our next episode, I believe, or the one after next, talking about the whole bracing process. Casting, unfortunately, some countries has casting, and it's very important, especially in the US, the early onset scoliosis, and of course surgery comes on the top of the mountain for the management of scoliosis. It's very important, especially in syndromic and congenital. Surgery consider 100% the management. There's no exercise for the babies. There's no casting. Not casting. There's no bracing. Sometimes we do alternating casting and surgery in the first few years with all the requirement, indication, contraindication. In brief, the management protocol has to be determined according to the proper diagnosis. Why I put this episode here? Because again, I've seen surgeons, they tell the patient, okay, you are 35 degrees, we're not going to do nothing for you, you're good, you are asymptomatic, you just have a curvature, just wait and see. And they want to wait till the patient reaches the maturity, or just before the maturity, for the surgical intervention to do a surgery which could be avoided earlier if we apply the management and the conservative treatment by bracing and exercise. Vice versa, I've seen some physical therapists, they do bracing and exercise in a very red flag surgical indicative patient or surgically indicative patient that bracing could make the case collapsed. And it's very critical and dangerous. Just because they don't know, they think the brace and the exercise are magic, which they are magic if they are applied in the right, correct way. So again, management protocol between observation, exercise, sport, bracing, casting, and surgery should be selected very, very cautiously according to our case and our patient. That's what I meant by the management protocol episode. And this protocol should be on the table. The patient family should be aware of it. It should be discussed, the risk, the cost, the time frame, the target needed, and our aim, first aim, primary aim, and secondary aim. And we have to follow the proper scientific literature in all our approach to any scoliosis patient. Again, this scoliosis channel is for all scoliosis healthcare provider, physical therapist, MD, DCs, orthotists, surgeon, and nurses, and it's for general public education, and most importantly for the patient and their family. We try to fill the gap among different scoliosis clinicians through the scientific literature and research paper. You guys have a wonderful day, and I will see you next time.